Hello and welcome to Wave Support. I see from your clinical request that you're struggling with this keratoconus fit in the right eye. It sounds from your history that was provided that the fit is reasonably good, but you're struggling mostly with the vision. Well, let's talk about the design in general. If we first look at the topography, this is actually a nice topography that you have. The data looks good, nice clean uh, uh, detail on here. So I think it looks like it's a good piece of topography to work with. If we look at your design is actually fine. I tend to like the tangential design quite a bit because I feel it gives me a pretty nice representation of this landing area out in the periphery. I think you chose a good starting point for your back OZ with the red dot. I might be inclined, if we look at that inferior meridian, to maybe move the blue dot in just a little bit further, a little closer, maybe bring it to like 6, 7 or so. But other than that, it actually looks pretty good. One thing you might notice from a fitting standpoint, if you recall, this is the front surface of the topography of the cornea that the wave represents, or the wave interprets. And if you look at this picture, this is the back surface of the contact lens. So one of the things that I try to do whenever I can, I try to get this back surface of the contact lens to look as close to this as I can. It's actually pretty good, but if you look in the principal meridians, you look at this upper meridian, you have a little bit of standoff here around the red dot, and then it comes down and lines very nicely through here. But it does sound like your fit is reasonably good overall. One little trick you can try, and each case is a little bit dependent or independent, but if I took that same design, I did move the blue dot in a little bit, but I switched over here and just added down to the right hand corner the S factor, just add a tiny bit of asphericity of the optical zone. And what you'll notice now when you look at this design, if I move it side by side to yours, you'll notice now in that superior meridian, where yours had a little bit of a lift over here, you can see it's actually brought that down very nicely, very smoothly. And if you look at the back surface of that contact lens, it's almost a perfect mirror image of the front surface of the cornea. So that's a little trick you can use sometimes if you're trying to fine-tune the fit. The other thing you can do, if you recall, tangential will tend to fit slightly on the flatter side. So if you tend to have a lens that's looks a little bit flat on the eye, you could steepen it up by just switching over to axial modality for your design, and that'll help steepen that lens up a little bit. So that's for the fit. Now for the vision, as you know, with these keratoconus patients, the refraction quite often is way off the mark from what the true power of the eye is, just because of the corneal toricity. So I usually like to do in these cases, especially with such a decentered cone, although I do enter the refractive data into this refraction box, I like to use the little tool down at the bottom here in case you haven't had the opportunity to use it yet. I click on Tool and Trial Lens Data, and I try to always make sure I get use a spherical gas perm lens of known parameters. I like to place it on the eye and over-refract over that, and enter that data in through here along with the over-refraction and hit continue. Now that can be a prior RGP lens, or if not, I like to use just something out of my fitting set, put it on there. It doesn't have to be exact, but I just like to get it on the eye, get some kind of refraction over there, because that gives you a really good way to get from point A to point B on that refraction for the power of the contact lens. And I found that it's very, very helpful in fine-tuning the power, and sometimes you might have to go back and fine-tune it a little bit, but now the over-refraction that you're getting usually on the dispense is much closer to the final lens. So with that said, I hope that is helpful information for you. I hope that'll get you back on track. Like I said, I think your design actually looks pretty good. Another alternative, if you struggle with comfort with this lens, or you can't get it to center properly, if you go to the Wave training video website, and I'll include a link on the email that I attached to this, there's a little tutorial on how to fit a Miniscleral lens for a cornea that looks almost identical to this, and sometimes the Minisclerals can be very helpful in centering also. So that should give you a couple options. I wish you well, and thank you for contacting Wave Support. Have a great day.